You got people calling, you got people coming in, but they're not scheduling or they're not accepting treatment. Why is that? You're about to find out. Okay, let's talk about one of the biggest frustration points. You've got marketing leads working, at least enough that the phone's ringing. You got people calling in and they're asking questions, but they're not scheduling. Or let's take this scenario. They're coming in, you're presenting, but they're not accepting. Two major areas of what we call conversion. Somebody's reaching toward you, they're call in, but they don't schedule. Somebody comes in and you present, but they don't accept. They're not converting to the next stage. Why? Well, we have found that one of the main reasons this happens is this, and I'm gonna do this crassly and I want you to follow along. In a winning sales scenario, it goes like this. You have a salesperson and you have a prospect. A winning sales situation is the salesperson is doing this and the prospect is doing this. In a losing sales situation, the salesperson is doing this and the prospect is doing this, which is a whole lot of nothing. In essence, what are you doing in treatment presentation? You're selling the person. Now, what are you selling them on? You're selling them on being healthier, getting the treatment they need to be fully rehabilitated and healthy, extending their life, right? All these things, but you are selling. Make no mistake about it, you are selling. So why is it falling down? Person calls in, they're asking questions, but whoever answered that phone isn't able to convert that into a scheduled call. Why is that? Well, you have to engage that person. You have to engage. You actually have to get that person talking. You have to ask them questions. You have to get them to talk about the one thing that anybody, most anybody, will talk about all day long. What is the one thing that anybody, most anybody, will talk about all day long? Themselves and their problems. Now, you can get carried away. Well, we do this and we offer this and we take these insurances and we have these services and blah, la, 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 onward. What is the prospect doing? You are setting yourself up for a loss. You offer so many things. There are so many things you do, and there might be only a few things that are important to that person, such as, I'm looking for the most painless path possible. I have recently been to another dental practice, and it was a corporate dental. I got treated like a number, and boy, I just feel like I was rushed in and rushed out as fast as I could be, and I'm not happy with my service. Whatever is the reason that they're calling you, and they haven't gone to a dentist or they haven't gone forward with treatment, you need to find that out. Well, how do you find that out? Well, you ask questions. What are some of the questions you can ask to engage a person? And what is that engagement process called? Let's talk about that for a second. It's called establishing rapport. And what is rapport? Well, rapport by definition is the close and harmonious relationship in which the people or groups concerned understand each other's feelings or ideas and communicate smoothly. Okay, so we now know we have to establish rapport with the patient, whether we're trying to get them in the office or we're trying to get them to accept treatment. What kind of questions can we ask to establish this rapport? Well, here's a couple. Can you describe what specific issues you're currently experiencing with your teeth? What prompted you to look into dental implants now? Are you experiencing any pain or discomfort in that particular area? Here's some other ones. These are related to symptoms and discomfort. Are there any areas where you feel pain when you chew? Have you noticed any teeth shifting or moving out of place? Those are just a few, and if you'd like those few, I've put together a little sheet with an explanation about this area, as well as some sample questions that you and your team can ask. So we'll make that available to you. But do I want your team reading from a sheet to ask those questions? I certainly do not. What I'm going to suggest is orienting your team around the idea that this engagement, well, this is what we do every day. When you're with people you like, when you're around people you're interested in, you ask questions about them because they're interesting and their stories are interesting and the things they have to tell you are interesting. When patients see that you're interested in them, wow, is there a difference? So I hope you're kind of getting it on this one. This very, very important point. In short, what I've been covering with you is just a little snippet of what we talk about at our ABC Communication and Sales Seminars. And what are we doing there? We're not trying to come in with the winning script. There is no winning script. The winning script is no script. The winning approach is you honestly being very interested in your patients, their care, their health, their future. And as a result, your patient's really feeling it and deciding you're the office for them, and they want to go forward with that treatment after all. So that wraps up this tip. If you like these tips, go ahead and hit subscribe and enable all notifications. You'll get a bunch more like this, and we'll see you on the next one.